Mononucleosis, commonly known as mono or the kissing disease, is an illness that may be more prevalent than most people realize. It's usually caused by the extremely widespread Epstein-Barr virus. In most cases, people recover from a bout of mono without any long-term effects. Usually medications will not help speed recovery, though some painkillers may ease symptoms. Knowing what precautions to take during the healing process can go a long way in helping you feel better sooner and avoid complications. Signs and symptoms of mononucleosis. For teens and adults who get sick with mono, the illness can knock them off their feet. Symptoms such as extreme fatigue, fever, muscle aches, and sore throat can be so debilitating that most people won't be able to maintain their normal routines for several weeks. Typical symptoms of mono include severe fatigue, fever, muscle aches, sore throat, swollen lymph nodes, headache, loss of appetite, pink rash all over the body that resembles measles, enlarged spleen or liver. Young children, however, are more likely to experience much milder symptoms, such as a mild fever, a temporary loss of appetite, or feeling more tired than usual. Or they may not have any symptoms at all. Doctors are not sure why teens and adults are hit harder by mono than younger children, but some believe that it may have to do with the differences in their immune systems. The milder reaction to EBV may have something to do with the fact that young children have immune systems that are more naive. When you reach adulthood without having had that infection, you'll be hit harder. But if you have a sore throat and a fever for 7 days or feel excessively exhausted, it may be a sign that you have mono, especially if you are a teen or young adult who has never had the illness before. Causes and risk factors of mononucleosis. Mono is a contagious illness that's caused primarily by EBV. EBV is spread from one person to another through saliva, which is why mono is referred to as the kissing disease. It's spread most efficiently through direct contact, but doctors also advise against sharing cups, utensils, or toothbrushes with anyone who has mono to avoid catching the virus that causes it. The virus can also be transmitted through sexual contact or, rarely, through blood transfusions. It's not known exactly how long someone can be contagious after they get the virus. Doctors generally recommend that intimate partners and family members try to avoid contact with the saliva of someone who's had mono for a few months after mono symptoms go away, including avoiding kissing and having sex. EBV can remain in the saliva for months, long after the usual 4 to 6 weeks that symptoms tend to linger. The exact length of time that someone with EBV is contagious can vary, however. People can shed the virus in their oral secretions for several years, and the shedding is intermittent. Most people get the virus from someone who's completely asymptomatic. But that's no reason to panic and avoid contact with anyone and everyone. An estimated 90 to 95% of adults worldwide are infected with EBV, or have been at some point in their lives. But not everyone who gets EBV will develop symptoms. Only 1 in 4 people who are infected with the virus go on to develop mono. Once you get EBV, the virus stays in your body for the rest of your life, though in most cases, it will remain harmless and dormant, thanks to your immune system. Patients with AIDS and others with weak immune systems are at risk of reactivation of EBV and mono symptoms. Rarely, some patients will have a recurrence of mono symptoms months or years later. Infrequently, some people may go on to develop complications related to acute EBV infection and mono, such as anemia, hepatitis, immune disorders, such as MS, or nervous system problems, such as Guillain-Barré syndrome, meningitis, or Bell's palsy. Although EBV causes an estimated 90% of mono, the illness can also develop as a result of these other infections. Adenovirus, cytomegalovirus, hepatitis A, B, or C, herpes simplex virus, HIV, rubella, toxoplasmosis. Duration of mononucleosis. Many of your mono symptoms, such as a sore throat, muscle aches, and fever, should improve in a couple of weeks to a month. But fatigue and enlarged lymph nodes and spleen may take a bit longer to go away. Treatment and medication options for mononucleosis. There is no cure for mono, and doctors typically don't prescribe medication, though sometimes an over-the-counter analgesic may be recommended to treat fever or muscle aches. The gold standard mono treatment is usually to stay home, drink plenty of fluids, and get plenty of rest, prevention of mononucleosis. Since mono is transmitted from one person to another through saliva, the best method to prevent infection is to avoid activities such as kissing or sharing food or utensils with someone who has the illness until they have fully recovered. It's important to remember that EBV may be present in someone who's had mono for months after the infection, so even if many of their symptoms, such as fever or sore throat, have improved, they may still be infectious. While there is currently no vaccine available for mono, researchers at the University of Minnesota's Mono Project, led by Balfour, are working on creating what may be the first vaccine to protect against EBV.
Thanks for watching. Please like, share, and subscribe for more health tidbits.